Hey YouTube, it's Marita and welcome to another edition of the Nurse Lounge. And in today's edition, we're actually going to talk about something that just kind of came to my mind, I want to say within the last month or so, as I am educating nursing students in the simulation lab. And that happens to be, so what should I do if I've been in nursing school and I haven't had any clinicals because of COVID? You are what I call my COVID nurses. COVID nursing students, shall I say. And I have something to share with you. If you want to see what I'm talking about, please stay tuned. We are back. My name is Dr. Marita P. I'm a registered nurse. I've been a nurse for 16, almost 17 years now. And I'm an OB/GYN, well baby nursery nurse. I am a nurse educator. I teach at a HBCU and I'm doctorally prepared. So now that we got that out the way, let's go ahead and jump into today's topic. And that happens to be what I call my COVID nursing students. So what does that mean exactly to me? Okay, this is just a term that I made up. This doesn't mean anything. You're not going to research it, find it, or whatever. But this is just some tips or some advice that I want to provide for you all, because being that you all are specifically in nursing school at a moment in time that you may have had either limited clinical experience or no clinical experience, I kind of want to share with you some things that you need to be thinking about when you go out there to your first job. Okay, so with that being said, think about this. So you have been either very limited in clinicals, you have been not going to clinicals at all, you've been in the simulation lab, you've been doing virtual clinical online, whatever you all have been doing to facilitate the clinical component. You are at a deficit compared to when I came out of school or when anybody else comes out of nursing school, only because of the fact that you have limited experiences. And again, like the program that I'm teaching in, one of the programs I'm teaching in, I teach in two different programs. One I teach in, they are going to clinicals, but they go like every other week. So they're at a more of an advantage than the ones that I teach full time who are not going to clinicals currently. We do virtual clinical and we do simulation. As you all know, simulation is great and it has its place. I'm not knocking it at all. But what I do want to say is simulation does not substitute, okay? It does not substitute for hands-on experience in the clinical environment. So I have had students, when they are in clinical, the very first day of clinical, they're too afraid to even go knock on the door because their anxiety is up. They haven't did anything yet. It's the first day of clinical. So imagine what you're going to feel like when you've not had clinical at all in your entire nursing school career. It's been, maybe you started, let's say you started nursing school back in 2020 when COVID first started, and now you're about to graduate this year. So let's say you started in spring of January of 2020, you're going to finish by December of 2021. And depending on what your school is doing, you may have had very limited or no experience when it comes to clinicals. So what is it going to be like for you going out there? And I've heard faculty say, oh, well, they will work with you. They will understand. They will not put you by yourself. They will not do. Okay, you know what? All that aside, some of these hospitals not even worried about all that. They are aware, but they don't know which schools have had clinicals and which have not. They don't have a list that says, okay, this school had clinicals and they had clinicals every other week. This school had no clinicals. Okay, so we're going to have to work with them. They don't know that. They don't know any of that. So this is what you need to do. You're about to graduate. You're applying for jobs and you are about to be interviewed. Okay, it's time for the interview. You need to go ahead and put up front that, you know what, this, I'm in school at a period of time in which I have not had clinicals or I've had limited clinicals, and I feel like I'm not as proficient on my skills as I should be, or as I would be, that's the word, would be, because of the fact that we have not had access to clinicals. We've had online virtual clinical simulations and on campus or whatever y'all doing. So you need to go ahead and voice that to your whoever's interviewing you, whether it be like the manager or whoever up front. And 9 times out of 10, they're still gonna hire you because of the fact why we need nurses. And not only that, they can train you. So I want you to understand you can be trained regardless. So don't feel like, okay, I don't know how to do anything, they're not gonna hire me. Oh yeah, if that hospital don't, another one will across the street. So don't worry about that. You'll get a job. But this is where I need you to be your own advocate. I need you to go in there and say, you know what, I would best benefit from me having maybe a day or two or three, a few shifts in either same day surgery, ER, or both. Why do I say that? I say that because some of the skills that you are not going to have, because doing an IV on a rubber arm or hand, or doing a Foley and a male or female part that's also rubber, that is also looks nothing like the anatomy of a real man or woman. When I say that, it does have the general appearance of the anatomy of a real man or woman, but an older woman's anatomy, her urethra and how everything lays out down there is not the same as a younger woman. And after you have a baby, it's definitely different. And then again, we just all look different. Now, a man looks like a man for the most part. But what if he has his urethra is on the side? There's a term for that, but I won't get into that right now. Do you see what I'm saying? So what if, have you been trained how to do that? When you go to the real world, or what if he's uncircumcised, meaning the foreskin is over the penis head? So what if that's there? And then of course in a mannequin, it don't, at least the ones I have, the simulators we have, or the parts we have, don't have no circumcised or uncircumcised. Everything is circumcised. That's not reality. So I'm just saying that you think, okay, you may want to go to a same day surgery or a ER and work, 2 or 3 shifts until you hone in on those IV starts and those Foleys, because they do those in both places all the time, especially same day surgery. Same day surgery, always you're going to have some IVs, you're always going to have some Foleys, always. So either there or ER to get your experience. Go tell them that you need that. So that way you go in there knowing I'm at a deficit right now and I can go in and learn those skills. So those are 2 big skills that you need to know how to do for most med-surg and other units in the hospital. You need that for ER, same day surgery, OB. You need that for regular med-surg, step down. You need that for ICU. You need to do all those things. Now, mind you, in ICU, a lot of times they come like that. If they're coming from the ER, coming from another floor, they're coming up to ICU, or if they're coming from step down, back from ICU back to step down, they usually come with that already. However, it may be time to change the IV, or it may be someone who gets a direct admit from the ER to ICU, or from the ER to step down. Now in the ER, they always start the IVs in the AC, which we hate on the floor. We know why y'all do it in the ER, but we hate it on the floor because it's positional. So every time they move their arm, what happens? The pump goes off because it's occluded because they don't move their arm. So we end up having to either infiltrates on its own, or we just have to move it because we're annoyed with the pump going off. Either way, you need to learn how to do that skill. So that's a skill as an example that you can learn how to do very quick in one of those 2 areas. Now, when it comes to some of these other little skills you'll have to do in terms of clean to dry dressings, or not clean to dry, wet to dry dressings is what I'm trying to say. Dressing changes. See if you can follow the wound nurse around. The wound nurse. See if you can follow him or her around part of a day or a couple of shifts, so they can show you how to do the wet to dry dressings and things like that. When it comes to trach care, you will learn a lot of these things on the floor, but in terms of the things that you need to know how to do pretty much like that, to be more independent, are your IVs and your Foleys. If you can do those 2 things, then you're pretty much good to go. When it comes to med pass administration, when it comes to your assessments and things like that, that will happen over time. You will not be proficient when you first come out because you haven't had experience doing it. So you have to be mindful that you have to tell them, I have not had the experiences that most nurses have had coming out of school. Again, they do not know whether you went to a school that had clinical or did not. You have to be your advocate to say, I have not had clinical, I have not had this, I have not had this, and these are the things that I need. If you don't do that, you're selling yourself short. And when you get, when it's time for them to put you with a preceptor for orientation, they're going to put you with somebody. And if you have not voiced to him or her your same issues that you have, they don't know, for one, how to help you. And when they have to go back and evaluate you and they're saying, well, how did she do or how did he do? he or she's going to have negative marks for you because they're going to be like, okay, well, they can't do nothing. They don't know how to start an IV. They don't know how to do this. They don't know how to organize, don't know how to prioritize. They don't know how to time manage. They don't know how to do nothing. You don't want them talking about you like that. And it really is not your fault. You can't help it that COVID happened. You can't help it that schools are not going to clinicals. You cannot help it that hospitals are not accepting students to come to clinicals in some areas. Okay, this is not everywhere, but in some areas. If you happen to fall into this category where you have had very limited or no clinical experience, you have to be your own advocate, and you have to simply say, this is what I need in order for me to be where I need to be. If you are afraid to say that, you're at a detriment. I'm telling you, you're at a detriment. So that's the biggest thing I want to say is be an advocate for yourself. I want to say that you need to go ahead and speak up front when you go to your interview and let them know I am not where I would be. Again, choose your words carefully. I'm not where I would be, not should be. I'm not where I would be if I had clinicals, because our program did not have a clinical site. We did not go to clinicals. We spent our time mostly in simulation. And again, explain, doing a IV arm or hand is not the same as doing it on a real person. Knocking at somebody's door and waiting for them to respond is not the same thing as doing it in simulation where no one says anything. I want to make sure you understand that it's going to be quite different for you. I want you to take your time on yourself. I want you to give yourself time to grow. I want you to know that errors will be made. Errors are going to be made regardless of whether you had clinical or not, because we all make errors. So don't let anybody think that they don't. We all make errors. But I am saying that you have to be your own advocate, because no one's going to stand for you harder than you, because nobody else cares. Okay, there are going to be few people who care, but for the most part, we are all out here trying to do our own thing, trying to learn in the midst of a pandemic. And so what they're going to a lot of times try to do is throw you out there. They're going to say, okay, you know what, you got this, and they gone. You can't find your preceptor. So I want you to be upfront and say what you can and cannot do. Or maybe you did have experience, great, but maybe it was limited. Maybe you only had one shift at the hospital or 2 shifts per rotation compared to having 4 or 5, because they wanted you to have experiences, but they wanted to limit them because of COVID. All understandable. But you, again, have to be your advocate. No one can advocate for you but you. So I want to drop that gem on you, because you all are about to graduate or have already graduated, and you may feel frustrated. And you're like, okay, well, how come nobody knows this? Well, nobody's going to know because they don't know what school you went to. You have to be your advocate. If you have any questions or concerns, you want to have some comments, drop that in the box or the comment section below. Also, we are about 130 or so away from having 2,000 subscribers. I need you all to help me get there, because I want to come to you doing live Q&As in which I answer your nursing questions live. So we can talk real time about whatever it is you have questions regarding nursing, regarding what I did or didn't do, my advice, my recommendations, all of that. If you want that to happen, I need you to subscribe to this channel. Even if you're not a nurse, but you happen to like either this content or the other content, subscribe to this channel to help those nursing students out, or anybody in nursing who wants to know, what is it like to be an OB nurse? What is it like to be an educator? What have I been through with microaggressions? Because microaggressions always happen to us in nursing, or in the whole world in general, but in nursing specifically. Anyway, like, comment, subscribe, share. Follow me on IG if you so choose. Questions in the comments. Let's chat as usual. Until the next time, you all take care. Bye-bye.